More equipment is needed to protect those on the front lines of the coronavirus pandemic. A global industry group for nurses is sounding the alarm as more health workers fall ill from COVID-19.
Nurses at this medical center in Los Angeles stood in silent protest on Monday night. They're demanding better protection for medical workers battling COVID-19.
We are in a war with an invisible enemy, and this enemy has already done more damage to the American economy and American society than any other foreign power has in the past.
Frontliners around the world are under immense pressure and danger as the pandemic worsens. Some of the worst hit countries are reporting high infection rates among doctors and nurses. In Italy, about 9% of health workers contract the virus. In Spain, it's as high as 12 to 14%.
We have no doubt that the rate of infections is related in part to the lack of PPE, personal protective equipment. We know that there is a global shortage and nurses obviously are at a higher risk given the people who they're caring for, and without that protection, their safety, their welfare is also at risk.
Amid critical shortages, doctors and nurses are forced to reuse their gear, leaving them vulnerable to infection. Others have had to improvise or make their own masks and gowns, using anything from raincoats to garbage bags. The International Council of Nurses says manufacturers and governments must work together to ensure much-needed equipment gets to hospitals.
Increasing the supply of protective personal equipment. There's definitely a role for manufacturers to step up to increase the supply. We need to see governments collaborate more. Some of the issues with the lack of flights, some border control issues, they get in the way of distribution as well.
And as the coronavirus spreads to poorer nations, the Council warns health workers across Africa and South Asia could be at even greater risk.